Today we are here. This is all part of the ministry's effort for national health reform. We are working for the country in terms of how we can help to bring down our costs of healthcare while maintaining the quality or improving the quality. So we're really focused on how do we really overhaul our whole healthcare system. An important part of that is something that a lot of people speak about, is the high cost of prescription drugs. And as we look at it, we've studied different countries. We've looked at Aruba, we've looked at Curacao, and we looked at how they did things and what went well and what didn't go so well. We learned from their lessons, and that's what we are incorporating here today. So as we look at our costs of prescription drugs, one of the things that we found that is in our legislation, we miss a Gvs committee. And so today, for the first time, St. Martin is incorporating its Gvs committee. And so the task of the committee really is going to be to look at how do we bring down the cost of our prescription drugs. We've already had a consultant who we've hired. Thank you to the assistants to SZV. Thank you for being here as well. So we've already identified 50 of the most used drugs. We're in the process of looking at how we can bring those prices down. And I have to say that initial studies show that we can bring down our costs by as much as 6 million guilders a year while maintaining quality. And so this is a great step forward. And so today we're going to be handing out the LBAs for the members of the committee. Okay, the first one is for Ms. Lucienne Wespel. Come on up. Your official LBA. Welcome aboard. The next one is for Mr. Andreas Illis. Thank you so much. And Dr. Gabby Venice.
This afternoon, I'm here to give a very short presentation, nothing long, and I will be presenting the following: the goals of the ministry in regards to healthcare services, why the Gvs Committee, the responsibilities of the Gvs Committee to the Minister of Public Health, the help desk. After my presentation, you will be granted the opportunity to ask questions pertaining to what was presented. Goals of the Ministry for Healthcare Services. The ministry's goals is to transform our current healthcare system from a supply-driven system to a value-driven healthcare system. Value is often described as the balance between quality and cost, and thus our objective is to enhance value by improving quality while containing costs. Why the Gvs Committee? The Gvs Committee fulfills in this process a vital role as they are an important advisory body to the Minister of Public Health on all matters pertaining to the system regulating the remuneration cost of pharmaceuticals. The main purpose of the Gvs Committee is to assess the reimbursement limits of pharmaceuticals that are identical and interchangeable. In such cases, it is legislated that the reimbursement of the entire cost of the most expensive of the group will not be fully compensated. To secure this process, the following tasks are assigned to the Gvs Committee. The assessment of applications submitted to be included in the attachments belonging to the herefore mentioned national degree. 2, providing information or informed advice to the minister on the committee's assessment in regards to submitted application. 3, to provide solicited and unsolicited advice to the minister on all matters, including proposed amendments of the national degree regulating the remuneration cost of medication. I have problems with that word. Additional responsibilities. The committee shall establish regulations concerning its method of work, the so-called house rules. I have taken the initiative in drafting and summarizing some important notes for you guys as committee members to consider when establishing your house rules. They are very important rules, notes to take into consideration, and they are found in your green folder. And they give you a little guideline as to how best to establish your house rules. Your house rules requires the approval of the minister. Number 2, the committee shall establish an annual budget for the following calendar year. This too requires the approval of the minister. Number 3, the committee shall submit a yearly financial report of the statement of income and expenditure of the preceding calendar year and a general report of its activities, including planned activities for the upcoming year. This is to be done within 5 months after the end of each calendar year. This also requires the approval of the minister. That's number 3. Along with these notes in your folder, you will find some additional information that is needed from the Gvs committee members in order to regulate and secure your payments. I will not list it all up. It is right behind the notes that I've placed for you to consider when establishing your house rules. Okay? The help desk. Article 25 of the herefore mentioned national degree makes provision for the committee to receive administrative assistance through means of a help desk. The employees of this help desk will be made available by the Social and Health Insurance Company, SZV. The appointment of the employees of the help desk requires the consent of the Gvs committee. The staff of the help desk serve as an advocate, administrator, and resource to enhance or enable the committee to fulfill its charge and accomplish its goals in accordance to its mission, vision, and strategic plan. Okay, and that was the end of my presentation.